Well, it's hard to think about heading back to school already.
But it's a perfect time to make sure those immunizations are up to date. CBS 4's Gloria Neal joins us in our Interactive Help Center. She's getting some expert advice, and Glo, it can be confusing to make sure that all of your family's vaccines are actually up to date.
It can be confusing, Karen and Michelle, but you know, with this new push to put more emphasis on the vaccine for infants, the CDC is holding meetings in major cities all across the country. So, what does that mean for us right here in Colorado? I've always got somebody good to talk to you. Joining me here in the Interactive Help Center is Christine Schmidt. She's a public health nurse who supervises the Jefferson County Immunization Program. So I'm just going to get to it because there's so much when you start talking vaccination. So what are the requirements as far as vaccination goes for kids entering school in Colorado?
Well, there is a list of immunizations that children are required to get for school entry. That list is set by Colorado school law, and it affects children as early as babies entering child care centers, entering kindergarten, elementary school, middle school, and high school.
So it's a separate set for each one, but they're all there and there are requirements.
It's very much the same immunizations, but the recommendations are to begin them early. And if they have a little bit of a late start, then there's a catch-up schedule, but they're very much the same immunizations. And it is confusing for parents. I would suggest that, or I would offer parents to check our website, www.jeffco.us/health, to get the full list to see for themselves.
And I'll have that on my blog at cbsdenver.com. But Christine, why do the vaccination guidelines seem to change from year to year? It seems that, you know, that's what makes it confusing. What's the case there?
I can understand how parents would feel that the changes are fast and furious and every year. What happens is that the Centers for Disease Control and Protection in Atlanta monitors diseases, these infectious diseases that the vaccines prevent against ongoingly. And so every year they may learn something new that they can then make some different decisions about how many vaccines a child may need and at what age it may be safe for them to start. And actually, if a child can start a vaccine a little bit younger, it does then protect them for a longer time in life. And then they also maybe decide that with diseases rising, it's important for a child to have a booster, an older child to have a booster. So they get that information down and then they release it to all of us for our use.
So then what about kids going into college? Why or how important is it for those kids, young adults, to be vaccinated?
It's very important for young adults to have vaccines because when you think about it, they're entering into a whole new social system. They're going to have contact with young adults from perhaps all over the world who may or may not be immunized, as well as American children may for some diseases or many diseases. And so with this and sharing drinks or water bottles or whatever, they're very high risk and living in communal quarters. And so the vaccine that we really are looking at for them is the meningococcal vaccine now.
Absolutely, absolutely. And last question, ability to pay. If a family cannot afford to pay, is there help out there for them to get their children immunized?
Yes, there is. We have a Vaccines for Children program. It's a federal program. It applies to providers, both private and public, to help vaccines be lower cost for children. So we offer that in many private physician offices as well as health departments like ours.
Excellent. Thank you so much, Christine.
You're very welcome.
So right now the CDC undecided, and why that's so important for that organization to make that recommendation, similar to what she was just saying, that will ensure the federal government and insurance companies will cover the shots for low income and underserved communities. Back to you, ladies. So lots of information, lots of good stuff, but just got to be up on top of it.
It is. Lots of good information. Thanks so much, Glo.
Absolutely.